So today is our third recording. Last week we talked about medication or not. As we mentioned last week, safety is the most important thing. And here at the clinic, many times we see kids and teenagers hurting themselves or even try suicide. So Dr. Dhingra, how often do you see them in the practice here?
Well, it's actually quite common. Many kids either have a current, symptomatology of self-harm, but many of them, even if they are not having any dangerous behaviors right now, they may have a past history. And for us, it's important to know if there's any history, present or past, and the details of it. So it's quite common, but many a times, it comes out only when you ask questions. It may not come out from the child or from the parent if we don't actively ask about it.
And to my surprise, a lot of times parents don't know their kids are hurting themselves. So what are the common signs of self-harm?
If the parents discover it on their own, like for example, if they find any injuries on the child's body, or the child, sometimes the children tell their parents,
True.
but there could be different scenarios at home. So some kids would want to hide the self-harming behavior, but some of them, they just go to their parents and say, this is what's going on. And another scenario is that when the child either actually harms herself or something, what we call a suicidal gesture. That means that there's no actual self-harm. At least that was not the intention of the child, but the purpose of that self-harming behavior is to get attention or to seek some kind of a secondary gain. So they actually want to make sure that someone sees their behavior. But whatever it is, if the parents find out on their own, they should let us know. Sometimes the information comes from the school, because many a times we've seen that kids trust their guidance counselors or teachers more. They may have a special bond with them.
Yes, or sometimes they tell their friends, and their friends report to the guidance counselor.
Exactly. I mean, it's very common that teenagers would rather talk to teenagers about their personal problems rather than to adults. So it doesn't matter what the source is. As soon as we know that some sort of self-harm is going on or is being planned, we need to take action and see what's going on.
So what are the most common self-harm behavior? I mean, I know people are more familiar with the cuts, but what else?
Yeah, self-cutting is most common, and that's also done for various reasons. Many teenage girls, even boys many a times, they cut themselves not with a suicidal intent, but many of them say that it gives them a sense of relief
True.
from their emotional whatever problems they're having. The point here is that whatever the intent is, it's still self-harm, and sometimes they may not want to do any serious damage to themselves, but it happens because sometimes the cuts are deep, sometimes they may infections, underlying damage to the tendons and the nerves. So whether it was attention seeking, whether it was a suicidal attempt, or whether it was just seeking some emotional relief, everything needs to be looked at, and safety is safety. So we have to take all these cases seriously.
So you are saying that the same cuts can be either suicide attempt or self-harming. So just because there are someone cutting doesn't mean necessarily they want to kill themselves.
Yeah, that's true. Most of them actually say that they
Did not want to kill
did not want to kill themselves. Most common reason that kids give is that they want some kind of emotional relief. I mean, we could get into the details of how self-harm could give an emotional relief, because it sounds very paradoxical that on one hand you're giving yourself pain and then you want relief from the pain, but they say that physical pain overshadows the emotional pain. That's a very common explanation. But kids don't know the anatomy of the body. They may be just trying to get some emotional relief, but many of the arteries are just below the skin, and if they cut the artery, they may just bleed
Yes.
excessively. So this is just one of the ways. The other common thing that we see is um, overdosing with
True.
medications.
Yes, that's a source of health harm too. So just because they're using marijuana doesn't mean they're only substance abuser. Maybe they are just over medicating themselves to cover their emotional pain.
Yes, and also um, kids don't know what the medications do to their body. Sometimes they know that, okay, this is a tranquilizer, it'll help them go to sleep. This one is, anti-allergic, it'll make them sleepy. But many times we've seen that the act of overdosing with medications is impulsive. They open the closet or the bathroom cabinet, they see a bottle of pills, take a bunch of them, and swallow.
Yes.
And many times they don't even know which pills they're taking. They can't even recall which pills they took. So,
And that's a danger with teenagers because they are impulsive, they are a minor, and they may look like an adult, but they don't think like an adult, and they make these decisions that themselves will regret, and this can lead to lifelong disadvantages as well.
yeah, I mean, many of these medications can actually, if not kill the child, may damage some of the body organs, like liver damage and all. And it's since it's shown in movies and elsewhere that
It's all over the news, the
on the
celebrities are
news.
doing it.
So there are lots of copycat behaviors in children. And that's actually very true for self-cutting because it happens in groups. It's a group of
Yes.
girls. One of them does it. The other people either just want to copy that behavior because she's a popular girl and she does it. So why shouldn't we do it? I mean, teenagers copy each other all the time, but it
To
becomes
fit
a
in.
problem when it's about safety.
So what do I do if I find out my kid has been cutting herself or himself?
Um,
Should I send her to the emergency room? Should I call 911?
it's very important to seek help. Just don't ignore it. Don't just feel that, oh, it's a minor cut. It's not about the severity of the cut. It's about
The behavior.
why, the behavior. Why would a child harm himself or herself? There must be something going on in the background. So just because, this person just took like 3 tablets of Advil, but it's not about how many pills she took. It's about
The intention.
the intention.
Yes, exactly.
So, if you feel that the child doesn't have, if the child actually doesn't have a psychiatrist or a therapist and something urgent is going on, of course, you need to get to the emergency room. But if the child has a psychiatrist or a therapist and that person can be reached, then first step would be to make a call and inform the therapist about what's going on.
Yes, and depends on the severity of the cut. Maybe the child needs to see a therapist, or maybe the child needs to be evaluated by a psychiatrist ASAP. And Dr. Dhingra just made a very important point that it's not about the injury, it's about the intention. The kid may only took 3 pills, but she wanted to kill herself. That's more severe than someone who took a bunch of pills, but he just wanted to have a good sleep.
Yeah, and know that kids will always have not so great judgment about the medications. They may have a particular intention about this, but it may end up in a dangerous way. They may have a dangerous intention, but nothing may happen. But you won't know until you bring it out in open and discuss with the treatment team. Here we have to also talk about parents' responsibility.
True.
Because see, I understand that a child cannot be supervised 24/7, and if he or she has any dangerous intentions, things happen. But at least at home, when it comes to medication safety, we keep telling the parents about how the parents should be responsible for the medication. They should not have medications just lying around. And you must have also seen in your experience that the child says medicines were just lying around and it was easy access.
Yes, I was actually surprised to see a lot of teenagers were giving the responsibility to take medication themselves, while at the same time they would keep telling the parents it's your responsibility as adults to distribute the medication, because kids may not want to take it, and kids may think, oh, sorry, I missed my medication yesterday, so I should just take 3 pills at the same time, then I don't have to take them tomorrow. And that's wrong. And it's the adult's responsibility.
Yeah, so that further proves the point that, intention is important, and also sometimes, intention may be benign, like the person is just, compensating for the missed dose, but it's still dangerous, and we have to advise that, okay, if you miss a particular dose of the medication, don't just double it up the next day. So we have to get into the nitty-gritties of these dynamics to first of all understand what happened and why it happened. All overdoses are not alike, all self-cutting behaviors are not alike, all of them have different backgrounds. So unless we get to the background, we won't know how to treat that child.
And I find in my practice that a lot of times parents are so terrified that their kids did something to themselves, and they keep asking the kids why. And a lot of times the kids doesn't know. So instead of asking why, I think the better question would be what happened. What happened before you cut yourself? What happened that day? And kids are more able to open up with what happened compared to why, because sometimes they didn't know themselves.
Right. I mean, for parents, I would suggest that you may be very anxious if you discover any injuries on your child's body, but at that time it's very important to stay calm and be supportive. If you become panicky and if you lose your temper, if you ask too many questions, it'll just exacerbate the child's anxiety and will further lead to self-harm. So stay calm, talk to the child in a very supportive way, and seek help.
Yes. And also, I think it doesn't hurt to kind of tell the children in general that, oh, I know this kind of behaviors are going on, just to let you know if anything you can talk to mom or father, or if anything happens to your friends. Because it's a lot of pressure if I have to hide this secret from my best friend. And it's safer for the child to feel okay to tell the guidance counselor. And if you don't feel okay, tell the parents, you can talk to guidance counselor or any teacher in the school.
Right. Well, the last thing you want to do is give the child guilt feelings about that. I mean, of course, it's not a good thing to harm oneself. But then if that thing has happened, instead of criticizing the child or blaming, like, why are you putting yourself in trouble and putting me in trouble, just be supportive and seek help. That brings us to another important issue. Parents panic, and they feel that if something bad has happened to the child, some injury has happened, overdose or, cutting, they will be in trouble. Social workers from ACS will be after them, the child will be removed from their home.
Sit in the movie all the time.
Yeah, so we have to, it's our job to educate the parents that as long as you're doing the right thing, no one can take your child away from you.
Yes.
Not reporting it is more dangerous than, so don't worry about if someone is going to take your child away. That doesn't happen as long as you are taking your child for treatment and seeking help.
Yes, and most of the times teachers and social workers are mandated reporter. So sometimes if they see something, they will have to report. However, they are not there to do the investigation. So you may think you didn't do anything wrong, but it's up to the ACS to do the investigation. And most people working at ACS will want the children to be with the family, because we all think in most cases that's the healthiest way for the kids.
But ACS, Association for Children's Services, their purpose is to help the children and the families and the parents. So it's not like the moment a report is made to the ACS, it automatically means some sort of punishment or removal of the child from the household. Most of the cases actually, after some investigation, they are closed, if there's no further reason to investigate.
Definitely.
So just because a report is made doesn't automatically mean that it's the parent's fault.
Yes. And a lot of times it's not because that single event, there's a pattern. If the kid is in treatment, then we are looking at the past history of the parent supports, of the parent compliance, so all that matters. So if anything happens to your child, doesn't mean you did something wrong. Just mean that we have to find out what happened and how we can help your child together as a team.
Right. In fact, ACS provides resources. They tell you how to seek help, because sometimes parents are stressed themselves. They have their own issues or psychiatric illnesses going on, or they just need assistance with, how to be a better parent.
Sure.
So workshops, addresses of places where they can go and seek help.
Support groups.
Support
To meet
groups.
other parents with similar issues.
Right. So ACS is supposed to do all that, and they do it. So it's okay if an external agency is assisting you in all this.
Yeah, and if you don't have the resources, your social worker or therapist, they can connect you. That's what social workers do. We are advocates.
Yeah, I mean, these are services. They are not like cops. If you're not actively doing something bad to your child, you will get all the support. And most of the parents, they want good things for their kids. They just sometimes may not know how to help,
Yes.
but the intentions are good.
Yes. And
So-
sometimes it can be a miscommunication because we all want the good things for the kids.
Right. If you think that there's absolutely, no clue why these things are happening, why bad things are happening, parents may actually, reach these agencies on their own also, or take the help of the primary doctor, because primary doctor is a go-to person. The primary doctor can direct the parents to the psychiatrist, the
Yes.
therapist,
Yes.
and other services, social workers, and can also tell you that, okay, right now the child needs to go to the emergency room.
True.
You can't really wait.
Yes.
So if you know nothing else about what to do, just go to your primary doctor.
That's a great idea because not everyone are in this kind of mental health service already, but most people are in physical health services, and a lot of them are really familiar with their family physician, and they do have a good bond. So,
Another thing that just came to my mind is the fear that parents may have if they are not documented in US.
that's a good question.
So
Yes.
the moment the child does something dangerous and they feel, oh, now it's gonna come under scrutiny, the doctors, the social workers, they will report not just the injury to the child, but also their legal status to the authorities. Please know that legal status, immigration issues are different. Medical help, therapy, that's separate. Just because you're going to a hospital to seek help, that doesn't mean that someone is going to report your legal status to the authorities. When it comes to confidentiality, it doesn't matter what's the nationality of the person, what's the legal status, what's going on with the marital conflicts in the family. The only focus is to help the child at that time, and other issues are sidelined.
Yes, that's a very important point. Thank you for mentioning that. When we do intakes here, I have to gather all the information, and I don't even think we have that legal status there in the section. We asked about the past history, we asked about family history because that's all related to the care, and we don't care about anything else.
Right. We will continue this discussion because I know that this is a very detailed topic, and we have to talk about safety measures that parents can take at home.
True, safety plans.
Because
we
if
do.
something bad happens, well, it happened. Now, but what to do in future to
Yes.
prevent that kind of behavior? So we'll discuss all that in our next session. And related to this is another safety issue, that's aggressive behavior towards other people
True.
and property, because many a times when a child is angry or very sad, it could be a combination, some self-harm, some harm to others. Sometimes it's just agitation that leads to harm to people and could be unintended. So we need to get into the depths of these topics so that parents are clear about these things.
Okay.
So
See you next time.
yeah, thank you for listening, and we'll continue our discussion. We'll let you know what further topics we have, and if you have any questions, you could email to us. The email address will be in the link. Okay?
Thank you for watching.
Take
Bye.
care. Bye-bye.